Hey guys, welcome back to my channel, The ENT Resident. Today we'll be talking about the different ENT signs that you see in case of basilar skull fractures. Now we'll talk about what kind of a sign is this. Is it a clinical sign or a radiological sign? What do you see? In which case do you see it in? What is the reason behind it? And we'll also talk about why is it called so, and if there's any mnemonic or some high yield MCQ questions that I can tell you in regards to each one of those signs, I'll also talk about that. You can also now purchase my notes. I have added links in the description. Okay, so today we'll talk about 4 such signs. We'll talk about the battle sign, we'll talk about halo sign, the Laugier sign, and raccoon eyes sign. These are the 4 signs that we will be discussing today. So let's get started with our first sign. As you can see in this image over here, this is the battle sign. Now, battle sign is a clinical sign that we usually see when we are examining the ear. Now, what is it exactly? How do you describe it? Here we are seeing a bruising or ecchymosis over the mastoid region behind the ear, which usually appears after head trauma. And the condition that we usually see this in is a middle cranial fossa fracture. So, we see battle sign in middle cranial fossa fracture. Now, what is the reason behind this? So, here the patient, after having an injury, about 6 to 24 hours later, they develop this bluish black discoloration behind the ear over the mastoid process. And this happens because of the tracking of blood from the skull base fracture into the subcutaneous tissues over here. And that is the reason why it is important to remember this will be seen only 6 to 24 hours after the injury has happened, and it is never immediate. You have to remember that. And this is actually an eponym which is named after William Henry Battle. He was a British surgeon who described this mastoid bruising as a sign of basilar skull fracture. Now, some questions over here that you should know over here is, what is the most common artery that is involved in middle cranial fossa fracture? That is the middle meningeal artery. And what are some other signs that you can be seeing in relation to the basilar skull fracture? You could be seeing a dural tear, which can lead to CSF otorrhea or rhinorrhea, and that will lead to the halo sign. Then we can see a middle ear bleed happening, which can lead to a hemotympanum. And we can also have anterior cranial fossa fracture, which can lead to raccoon eyes. Now that's all about the battle sign. I have a small mnemonic that can help you remember battle sign. So let's remember B, 4B. So we have 4 B's over here. And what are they? B is for battle sign. B is for bruise. B is for basilar skull fracture. And B is for behind the ear. So basically, battle sign is a bruise that we are seeing in basilar skull fracture behind the ear. This is a very easy mnemonic to remember the battle sign. So that's all about battle sign. Moving on to our second sign over here, which is halo sign. Now, halo sign is a sign that we know, we have very commonly read about this. This is a clinical sign that we see, that we perform bedside in cases of suspected CSF leak in a patient. This can be a CSF leak involving the CSF otorrhea or CSF rhinorrhea. Whenever we are suspecting a CSF leak, this is the sign that we can check bedside as well. So what is it exactly? We see here that in this image, we are seeing a double ring-like appearance when we drop nasal discharge mixed with CSF on a filter paper. So here, how do you perform it? When we are suspecting CSF leak, we'll usually say when the patient bends forwards, there is a trickling of discharge coming out from the nose. This nasal discharge is allowed to drop on a piece of filter paper. When this CSF is mixed with a little blood, it gets absorbed onto the paper and it separates into a central dark blood spot that you're seeing and a outer clear ring of CSF. This happens because CSF actually has a lower viscosity and it is able to diffuse further away than the blood can. And that's why the CSF ends up forming this outer ring, which is a much lighter ring, and the blood ends up concentrating in the central area and forms the central dark blood spot. So, this leads to this pattern that you can see here that looks like a double ring. So, you can see this is one ring and this is one ring. So, because of this, halo sign is also known as double ring sign. And it has a third name. It is also known as the target sign, because you can, if you look at it, this looks like how a target sign looks like. So this is the reason why we have the halo sign or the target sign or the double ring sign, and this will be seen as a clinical bedside test when you drop the suspected CSF fluid onto a filtered paper. And the most common cause involved over here is a basilar skull fracture after head trauma that can lead to both development of either CSF otorrhea or CSF rhinorrhea. It is important here that this does not confirm 100% that this is a case of CSF. This is definitely suggestive of it, but if you want to confirm CSF, then the gold standard test for that would be a beta 2 transferrin. This, if you find beta 2 transferrin, this will confirm that this is a CSF. And if CSF leaks get untreated, the most common complication and very deadly complication that can develop as a result of this is a case of meningitis. So this is about the halo sign on filter. Now, there's another halo sign that you can get confused with, and that is something that you see in case of cochlear otosclerosis. In cochlear otosclerosis, we see a radiological halo sign. That you should not be confused between the both of them. Halo sign on a filter paper is for suspected CSF leaks. Next, we move on to a third sign of the day, which is Laugier sign. Now, what is Laugier sign? This is a clinical sign that we are seeing on otoscopy. Now, what is it? How do we describe it? Here we are seeing the presence of blood behind the tympanic membrane after trauma. So basically, we are seeing a case of hemotympanum after a case of trauma. This is usually seen in a basilar skull fracture, particularly in case of temporal bone fractures. Now, if you look at a normal tympanic membrane, it usually looks like a pearly gray color or transparent, and it has visible landmarks. But if we look at this image over here, we are not able to see any pearly white color of the tympanic membrane. It's looking more bluish purple or dark reddish, and we can see that this is happening because of the collection of blood behind the tympanic membrane in the middle ear cavity. This is what is known as hemotympanum, meaning the presence of blood in the tympanic cavity, and all the landmarks have been lost over here. This has happened because when there is a basilar skull fracture, these leads to tear of the vessels in the temporal bone, and this tearing of the vessels leads to leaking of blood inside the middle ear cleft, and the tympanic membrane becomes discolored because of the collection of blood over here. And this is what is Laugier sign. This is an eponym, and it was named after Laugier, who was the one to describe hemotympanum as a diagnostic clue in basilar skull fractures. Now, it is important to remember that just because you're seeing hemotympanum does not mean that that is Laugier sign. Hemotympanum can occur because of other situations as well. For example, other causes of hemotympanum would involve barotrauma, or it can happen in a case of coagulopathy, or it can happen in a case of severe otitis media. So just because you see hemotympanum does not directly mean Laugier sign. Only when you see hemotympanum following trauma, that is when you call it as Laugier's sign. So that's what Laugier's sign is. Moving on to our last ENT sign in a basilar skull fractures. And as you can see, this is what is known as Raccoon eyes sign. Now, what is this exactly? This is also a clinical sign that we are seeing on examination of the eyes. What you're seeing is, if we had to describe is, we are seeing a bilateral periorbital bruising or ecchymosis, giving a dark discoloration around the eyes. And if you look at the image here, it resembles how a raccoon's eyes looks like. Also, the second animal that we know, and a very cute animal that it represents, is also panda. So this is also known as panda eyes as well. And where do we see this? This is typically seen in a case of anterior cranial fossa fracture. This happens because of the blood tracking into the loose periorbital tissues all around the eyes. And because it is looking like the eyes of a raccoon or a panda, that is why it is known as raccoon eyes sign or panda eyes sign. It is important to remember raccoon eyes sign directly points towards anterior cranial fossa, whereas battle sign directly points towards middle cranial fossa fracture. So that's about the 4 ENT signs that you see in case of a basilar skull fracture. If you have any doubts regarding this, please note them down in a comment section and I'll get back to you. Thank you.